Hi, this is Rech, physical therapist at Rech Physio. Today I'm going to take you through a mobility session to keep your joints moving well and help you to have less pain. So the three areas I'm going to focus on today are the hips, the upper back, and the ankles. So for the hips, I'm going to do a couple motions using this band. If you have any tightness in your hips, I've really had great results for myself using a band to get a little more distraction at the joint and get at the capsule. So I highly recommend, if you're having any tightness in your low back or your hips, to grab one of these bands. You can get them online on Amazon, and I think they work really well. So the first one is kind of be like a traditional hip flexor stretch, where you're in a half kneeling position. But you're going to use the band here to get a little bit more stretch in the capsule. So you want to do each stretch for about a minute or two to give your tissues time to elongate and to get some stretch there. And so what this does, when you're doing your normal hip flexor stretch like this, you're going to be stretching the muscles, but by adding the band, it's getting a little bit more pressure at the capsule, which is the ligament fascia structures that are kind of a sphere or a ball around all of your joints, and it's getting those, getting a little bit more stretch in those, which is going to help you a lot, especially if you're having tight hips or tightness in your low back, because your hip flexors attach to your lumbar spine, to the vertebrae in your low back. So if you're tight in your hips, that's going to be pulling on your low back. So it can be that tightness in the hip flexors or in your hip joint can be contributing to the stiffness or pain that you're having in your low back. So you can kind of stay in this position kind of statically without really moving, or you can kind of oscillate back and forth a little bit, squeezing your glutes. That's going to really push the head of your femur a little bit, or your thigh bone forward, and stretch out that capsule more. To get a little bit more stretch in the thigh too, you can pull that back foot up, and you're going to really feel a nice stretch in there. Always try to keep your glutes engaged. That's going to help push your hip forward, and you're going to really feel a good stretch with this. So it's been about a minute, 2 minutes there. So then you can switch and do that on the other side. So by pulling your foot up, you're going to get more of a stretch in the thigh. By squeezing the butt, you're going to push your thigh bone forward into the capsule, and you're going to feel a nice stretch in your hip joint. And then with the foot up, you also feel a nice stretch in the thigh muscle too. You can kind of go back and forth, scoot back, get a little bit more stretch. So for most of us, we spend a lot of time sitting, especially if you have a desk job. This is going to be a great exercise to do at the end of the day. A lot of us watch TV at night. If you can kind of spend a few minutes while you're watching TV doing some of these, that's a great way to fit it into your day. Stretch a little bit like this. You just want to make sure that you're keeping your abs engaged and you're not just bending at your low back. You want to really focus on keeping the glutes engaged and the abs, so that you're really stretching at the hips and not just stretching in your lumbar spine. Like I said, you kind of oscillate back and forth a little bit. We'll do about 20 more seconds here. So you want to spend a minute to 2 minutes in each position, longer if you're really restricted or tight in that area. If you're doing a workout, it's good to do a little bit of a warm-up to get your muscles and your tissues warm, and then do this before you do the lift, so that way you have the adequate range of motion to complete all your different lifts. So the second motion that I like to do in the hips is using the band again, but this time I'm going to come out like this, so that the band is pulling my thigh bone out, and so we're stretching the capsule a little bit that way. And then I'm doing a hip flexor stretch again. I like to do it with my back foot up. I get a little bit of a stretch in the right side too. And same thing, kind of try to engage your glutes, keep your back in a fairly neutral position. And I just kind of oscillate here, going up and down. Which to get an idea if this is working for you, do some squats or do something where you kind of feel stiff. And then do these mobilizations, and then do that same motion again. And you're going to probably feel a lot more smoother of a motion, a lot more freer in your motion. So that way you can kind of see for yourself that it's working for you. Okay. So that's the hips. So your low back, or your upper back, I like to do on a foam roll. And get yourself positioned. I kind of try to give yourself a little bit of bear hug. It gets your shoulder blades out of the way. And what you're going to do is you're going to start at your kind of mid-low back area, and you're going to try to bend back at just one segment at a time. So you want to kind of keep your abs tight, so you're not just bending all at the low back all the time. You want to kind of keep that stable. And the motion should just be coming at the segment that's on the roll. So you can kind of work that area for a few seconds. Roll a little bit to about where the next joint is. Keep the abs tight, and then you're kind of working yourself forward and backwards there. So you're trying to get motion at just one segment at a time. So you're being really intentional and specific. And you can really target this if you know you have an area, or if you feel one spot that's really tight and not moving as much. Go ahead and spend more time in that area. Or if it's all about the same, you can kind of just go along the whole back. So you just one segment at a time, just rolling up and down your spine. Your neck's probably going to start to get tired. This is actually a good exercise for your neck muscles too. If you have headaches or if you get neck pain, the stronger your neck is, the better that's going to be. So you get kind of a 2-for-1 with that. If that gets too tired where it's bothering you, just go ahead and put your hands behind your back. And it also helps prevent you from kind of trying to lead with your head, because you don't need to necessarily reach back with your head. We're focusing on the thoracic spine. So as you get further up, you're not going to feel as much motion, which is fine, but you want to just keep trying to use the motion there. And again, you're not arching at the low back. You're staying very intentional and specific with that segment that you're at right there. So a lot of people will probably do something like this, which is fine. You're going to get a nice kind of massage for your muscles, or some mobility work with your muscles, which is actually good. You can kind of bias to one side and do that side a little bit. As you're going along, if you notice a spot that's a little more tender or a little more stiff, go ahead and spend some more time in that area. Okay, but then if you get to your upper back, I would just start working your way back down. So you spend a little bit of time at each segment again. Really trying to get the motion to come at that spot that's on the roll, and not from your low back or not from your neck. So you're trying to give each segment a little bit of work, and you're not just stretching at the same spot all the time. So you really need to keep your abs engaged so that your low back stays neutral, and the motion isn't just coming from your low back each time. Another good little core exercise if you want to do with the foam roll in a position like this is if you roll back this way and just hold this. This is going to be a really good core exercise. So you can try to hold that for a little while. Having your arms out front is going to make it easier. Arms back like that, it's going to get harder. So you can maybe do a little abs in between your mobility if you want there. So that's great for your upper back, especially if you're sitting a lot. If you're hunched forward, that's going to get you to stretch, arch back, and you should really feel a lot more freer in your upper back. Now the last thing is going to be for your ankles. So first, actually the easy thing you can do is just kneel like this. This is going to be a nice stretch for the front of your ankles. If I haven't done this for a while, I especially feel stiff in my left ankle. I sprained it pretty good a few years ago. So if you've had some of those previous injuries, doing some of this stuff, you're going to be one more mindful and diligent about doing it, because you are going to be a little more susceptible to getting stiff like that. To increase the stretch, lift up your knees, and you're going to feel a really nice stretch in the front of your ankles. Okay? Then, to stretch your ankles the other way, I like to use a band again. So you put your foot in, you want to try to get the band on top of the foot, just above the ankle joint, and then try to have it on top of a step, so that way the band is kind of pulling down. So I'll just use this kettlebell, and then what you're just going to do is use your body weight to stretch your ankle forward. And you can stretch this, kind of go back and forth a little bit for about a minute or so. So a really good time to do some of this mobility work is after a warm-up. So that way your blood is flowing and your tissues are warm and they're ready to be stretched or to be mobilized. And if you can do it before you do lifts, that's good, because then your joints are freer and are able to move better and achieve the correct positioning for your lifts. But if you're kind of cramped for time at the gym or stuff like that, even if you just do it for a few minutes at the end of the night when you're probably watching TV anyway, do a little mobility work while you're watching TV. That's a great time to do it. If you just get into that habit of trying to spend a few minutes at night working on an area, that's going to go a long way to being more pain-free and having better performance. Because if you have the proper range of motion and the proper extensibility at your joints, you're going to move better and you're going to be able to perform better, whether you just want to get up from a chair or just walk without pain, or if you're a runner or athlete or whatever competition you're in. Pick up basketball. The better you can move and the less pain you have, the better you're going to do, the better you're going to perform. So if you're having any issues in your joints, you're feeling really stiff, I'd highly recommend grabbing one of these bands. If you go on Amazon, you can find them. A lot of people use these as like a pull-up assist band, if you search for that. But I like to use them for mobility, and they work really awesome. And you'll feel better when you use them. If you're having any pain, or nobody who is, or trouble moving, message me. See how I can help. I'm a physical therapist here in Grand Island, but I do telehealth with anybody in Nebraska. If you have any questions or want me to do a video on any other body parts, just let me know and I'll work that in. Thanks for watching. Have a good weekend.